Welcome, everybody, to Slice of Pfeiffer. I'm Dr. Pfeiffer. I'm here with the one and the only Brittany DeBragoso, marketing expert, B Marketing. She and I have been working together for years, and so welcome.
Hi. I'm so happy to be your first guest.
Glad to have you here. So, yep, usually she is sitting in Taylor's seat. Taylor has run off to go take care of family, and so now here we are. We are wrapping up the end of a wild and crazy day.
I know. I want you to share about the day in life of Dr. Pfeiffer, because I don't think y'all know. He's a busy man.
So I was on call last night, so we had a busy night. It was, we take call and cover a level 2 trauma center. So I was on call all night. I came off call at 7 a.m. this morning, but had a lot of consults overnight and then had some patients who needed some surgery. So had to go in for a femoral nailing at 7:30 this morning. Bounced back out to clinic at 9 o'clock. We had 17 patients in clinic with me, and then Taylor had her own clinic as well today. So I think we saw maybe 30 or 35 patients today.
Dang.
Noontime, lunchtime, I bounced back over to the hospital to do a total hip arthroplasty, and then zip, zap, zoom, back here for the podcast. So getting Slice of Pfeiffer off, it's off and running, and here we are.
Here we are.
The life of an orthopedic surgeon.
/ marketing guru.
/ marketing.
Podcast guru.
Podcast wannabe, sort of, kind of. He's trying his best. That's what we'll say.
We're making it.
Yes, as Caroline would say, keep it up, Dad. Keep it up.
That's all you have to do.
She did tell me yesterday that she told all of her friends that I have a podcast while she was at school. So that did make me happy.
What a cool flex.
Yes.
She's how old again?
She is 12.
12. I mean, could you imagine? I would be bragging. My dad's famous.
Yeah, he's famous. It is kind of silly. I did release the podcast in a pre-release to my own family for like 14 people. I think I told you this. And I was like, I sent it to all of them, and 2 of them subscribed, and 1 of them liked it. I was like, what are you guys doing? You guys are my own family. Come on.
I need all the love right now. Please.
Come on. This would
be a good time for the crickets.
Oh, yeah. Or you can do the trombone. See, I do love this. All good. Well, but we are here to talk to you specifically about marketing and personal branding. We've been working hard with PB&J trying to do marketing and personal branding for my practice and for our personal brand and my personal brand, I should say. But you really are the expert. How long have you been doing marketing?
Sometimes I have to think back. I'm like, okay, wait, after I graduated college. So it's been 10 years.
10 years.
Yeah.
10 years out and about. And
I guess longer. Shoot. 12.
Nice.
Yeah. I'm like, I guess I graduated sooner than that. 12 years.
12 years of marketing. That's awesome.
And I love it. And I had an internship in high school too. So I worked with my stepmom who had a marketing firm, and she actually only worked with physicians. So we did a lot of community events, a lot of shaking hands, kissing babies, old school grassroots marketing.
Nice.
And it was what exposed me to what marketing is all about and how important it is for relationship building. And I realized, I'm like, okay, I think I want to do this. I think this could be so cool. And so went to school to U of H, studied advertising, minored in global business.
Awesome.
And I was thinking, I'm like, okay, so I have the experience of marketing firsthand, and then I'll learn in school about advertising, and then global business, get a little bit tidbit on how I can do this on my own. And here I am.
And here you are.
Yeah.
Now you're marketing for crazy bald-headed physicians who are like, hey, I'm going to go hide underneath this table and see if you can figure out where I'm at.
Let's make this fun.
Yes.
I will say that's my favorite thing about you, though, is that you are a fun client. You're not scared to be silly, to even embarrass yourself a little bit, and like all in the sake of just representing the brand and making it something, and like from nothing to something. We really have grown.
Right.
I mean, we started PB&J, last year? And it's turning into a thing, right? I mean, talk about what happens at the hospital.
Yes. I have a blast. Lots of people know. One of the fun things about going to the hospital and being an orthopedic surgeon is that a lot of people know you already, but I get a ton of people who ask me like, oh, hey, what? I mean, I had a patient who asked me in clinic today in our clinic what socks I was wearing. She was very disappointed that I was wearing taco socks and it's not Tuesday. And I was like, well,
You're manifesting that you want taco.
I was trying to drag my call of Tuesday into Wednesday so that I could
More
enjoy the
tacos.
taco socks.
Yeah.
But yeah, I mean, at the hospital, I mean, it's just fun. I enjoy seeing people smile, right? And having healthcare providers who who I respect and who I love working with, whether it's nurses, scrub techs, PAs, nurse practitioners, anesthesia assistants, physicians, the administrators there. I mean, it's fun to have people just smile and be like, "Oh, hey, I saw that video. I can't believe you wore that jacket.
Yeah.
I can't believe you guys did a 19-hour day back and forth to Dallas and
had so much fun doing
and had
it.
such a good time." Yeah.
We were so inspired after too.
It was awesome.
It
awesome.
really
That was super fun.
My favorite thing about the way that PB&J has kind of transformed, in my opinion, like the orthopedic game, is that a lot of patients come in pain, they're cranky, they're focusing on what's going on with them at that time, right? But then they get to know you on the social media side and they realize, okay, this doctor is actually relatable. He's funny. He's going to make me smile. It's not just clock in, clock out. It's actually, hey, how's your day? How are you doing? Let me try and brighten your day. And I think that's where you're spinning the game for orthopedic surgeons, you know?
Well, I mean, I love that. I love that about people. I love being able to treat people with respect, with dignity, but also, like I said, making people smile. And we get to see people in really the toughest parts of their life, right? So whether you're coming in with arthritis in your hip or arthritis in your shoulder, or you had a fracture, you were going through the emergency room and broke your ankle. Like, I mean, it's kind of stinks, right? It's just not good. And so I oftentimes say, "Oh, it's great to see you today." And most people are like, "Oh," and I'm like, "I know it's not that great to see me, but we're going to see what we can do to make things better."
We're going to make it better. And I think to highlight the making it better, I think you're changing the way orthopedics is looked at altogether. I mean, from wait time to being able to answer the phone right away, making sure that they're being seen within 24 hours. I mean, there's so much more than just putting a smile on their face. I feel like you're kind of going above and beyond on all areas to make sure the patient experience is actually enjoyable.
Right. And we're trying that. Taylor and I went through with the team, and we've talked with you about it too, just trying to make the patient experience good, right? Mm-hmm. Making it what's that highest level of experience? And I think we talked about this, like, what would you do if you had only one patient? If you had one patient, what would you do for that person to make sure that they brought you their family and a few more people? If you can write down all those different things that you would do, why aren't you doing it for everybody?
Exactly.
You should be doing it for everybody. And that, I think that doesn't just come with orthopedics. I mean, that could be any type of service industry that you're in, right? If you can do that for people, then you're really making a difference, making them happy, giving them something that makes them feel a little bit better by the end of the day. And I think that's awesome. So
for sure. Because I feel like with marketing, you can pass the ball all you want, but if you don't handle all the other odds and ends of making the patient experience a valuable one, then they're not going to come back.
Yeah.
You're not going to retain that patient. So I think that you do a great job, and it's making this a seamless business relationship.
Yes, very true, very true, and friendly relationship as well. So yeah, you can't spend 19 hours going back and forth and eating Whataburger and
karaokeing a little bit
and beef jerky and karaokeing in the party bus.
Endless of beef jerky lists.
Right, and not drinking Coke Zeros all the way back and forth. That was pretty fun, but it was pretty awesome. I mean, we got to hear people talk about just like changing your state of mind, which I thought was really awesome. Hearing Jesse Eitzler talk about "I don't get tired."
I don't get tired.
I thought that was inspiring. And then we were at that doctor's office just the other day, and Taylor's like, "Oh, we don't eat cold pizza.
We don't. We don't do that.
We don't eat cold pizza. We're gonna leave that pizza alone." And I was like,
"Do we have
really?
to?"
I think I might eat cold pizza.
Yeah,
I might eat 2-hour-old other doctors' pizza.
Yeah.
If they don't see me, it'll be fine.
We'll just sneak a little slice.
Yeah, it'll be fine. But
well, that conference inspired me to get back into running. So I definitely think like mind over matter, right?
Yep.
If you have the will, you can do it.
Yep. You can do it. I mean, I think that's important. The mindset, just, how big do you want to get? How great do you want to make the experience for a patient? Like, I mean, how can you do that? And so, or whether it's for other clients who aren't in medicine, or, I mean, cause you do medical, you have clients who are physicians, you have clients who are outside of here too. And so what makes the physician client difficult or more challenging or more fun, whatever, different, I should say, instead of difficult? What makes us different than dealing with some of the other folks you deal with?
Scheduling is a little tough, as you know. That's a hard one, right? But I think that's probably the most challenging, is making sure that my schedule can align with theirs, because I am a mom too, and I started B marketing so I could still always prioritize my family. So it's like, it's hard to juggle that. But right. I think when it comes to working with physicians, making sure that I can work in with their schedule, because sometimes it's after hours, And I think one thing that the reason I got into marketing and working with physicians primarily was because a lot of times, and different for you, I will say this, but a lot of physicians go to school, they're great with what they do, but they have no idea how to bring patients in the door. It's a challenging thing, right?
Right.
And so I noticed there was a niche that I could kind of fill that void. And a lot of times it's like referral based with other physicians. It's shaking hands with the community. It's getting people to know who you are and what you're about, what sets you apart. So I actually enjoy working with physicians, but I do like to kind of also venture out into things that inspire me too, like gyms and fashion and fun things that I love, like med spas and different stuff. So I kind of have dipped in my toes into other businesses as well. And I love it. Yeah.
Very cool. Well, that's awesome. Well, I love having you as part of the team.
I love it too.
I know Taylor loves it as well. We get to see all of the back end of everything with the numbers and whatnot as we start to see things continue to grow, but we also get to have a good time and have a lot of fun and that piece is really that's actually the most important part to me, because ultimately really enjoying what we do and getting to serve people is what we're here for, right?
Absolutely.
I mean, and getting to take care of people, right? It's like you just can't lose sight of that blessing in your life, right? And that privilege to be able to do that and have people who trust you, who can come and see you. And so to me, I think that's just really huge. I mean, it's such an amazing opportunity. And I'm loving sharing it with you. I appreciate you coming.
So it's so fun. Thank you for having me on. I was actually at our last content shoot. I was kind of like pinching myself. I'm like, what a fun client that I get to work with that just has a good time. We all laugh, but we're getting the job done, right? And sending a great message and inspiring other people. Like, I think we're actually doing some really cool stuff for the community. So I'm excited to be a part of it all.
It's going to be awesome.
Yeah.
So one of the things, I'm going to test this out with you. We can see if we want, but one of my questions that I wanted to ask other guests when the guests come on at the end, and I didn't tell you about this. So,
Great.
so it's not, don't worry. Maybe you should worry. But if there was one thing that I could do to help you, what would it be?
Ooh, I don't know. That's tough. I mean, you are already so helpful, you already inspire me in a lot of ways. You know what? I like that you challenge me to think outside of my box of what normal marketing is versus what we're trying to do, because we're changing the game, in my opinion, on what an average orthopedic surgeon looks like. And so I like that you're challenging me that way. You're pushing my limits and just helping me think outside of the box. So just keep pushing me, please. I like it.
Well,
inspires me.
That we can do. We're doing that already. But Brittany DeBergoso, Be Marketing extraordinaire. Thank you again. Great friend and partner. So I appreciate that. We want to get you to your family so that you can go see those kiddos.
Those babies.
Yes. And I told Taylor this, you got to just cherish those moments too. So don't lose sight, because those are so important, so important to enjoy your family and be with them.
Absolutely.
So thank you so much for being here.
Thanks
I know that
me.
We will probably see each other again, or maybe even talk as early as tomorrow.
I'll see you for sure next Wednesday,
Yes.
but then I will probably talk to you this evening.
Yes. Very good. Well, thanks so much for coming. I really appreciate it. And have a great day.
Yes, you too.
Awesome.